you'll see a guide for how you can access mental health services from home while we're staying home. Whether you're a student, young person, somebody who's been a victim of crime, domestic violence, whether you're a veteran, whether you're an older New Yorker, we break down these resources by categories and you can find something that's right for you.
Thank you so much. Thank you so much, Susan, for that. And we'll come back to more questions and we'll try to kick out these bots because, you know, when you do Zoom, you know, they make these comments. So we ask, you know, I won't even rile them up tonight, but we'll be trying to kick them out one by one. So the next question is for Pablo Sadler. And how are you? Is Pablo in?
Hello.
Is Pablo in? Do I see Pablo?
This is Anna Schatz. So Dr. Sadler had to leave. He had a stop at 8 p.m. So I'll be speaking for him. This is Anna Schatz from the Department of Health and Mental Hygiene. I'm a community coordinator on the community affairs team.
Awesome. So one question we had is for anyone feeling isolated and lonely during this time, how can they find a connection with others while quarantined or at home?
Thank you for this question. So just wanted to take a moment and say that it is normal for a disease outbreak to be stressful, especially since we're physically distant from our support systems. And isolation can also be disruptive given the changes to our routines. So tips on staying connected can include just staying in touch with others by phone or online, especially video chat like we're doing right now, and just maintaining your daily routine virtually as much as you can. Cook together with someone over a video chat, create game nights, stream a concert or a show that you enjoy, join a workout class if you can, or practice or hobby. And just participate in activities together and try to connect with others virtually, given, you know, with your phone, over video, over email, in any way that you can right now.
Awesome. And you said cook on Facebook Live? Just go through, go through that again?
Yeah,
so
virtually.
And I know it's a new wave now. My wife's birthday is coming up in a few weeks. She was talking about having a picnic in the backyard. I'm like, what a picnic? So I had to, like, in the back of my mind, start thinking, like, picturing, like, actually getting a blanket and put it in the backyard. So should we be becoming more spontaneous by cooking online and having family gatherings online?
Absolutely, yeah. There have been Zoom birthday parties. A lot of people feel, you know, isolated during this time when it's their birthdays and they are not able to connect with their families. But there have been Zoom birthday parties that have been happening where everyone just cooks a meal and sits in front of their computer and just eats it together, and stays together while apart.
Wow, that sounds interesting. And I actually, in my own household, it's funny, every Sunday now, my wife's family from England to here actually have you know, this little Zoom gathering. So that's been interesting. All right, we're gonna follow up now. We'll go to Dr. Veronica Jackson-Wiltshire, and I want to thank her once again for the work she's been doing. And I know during this particular moment in time, it's been really complicated for our children. They've all had to transition to this virtual learning. And I know that that's been complicated, trying to keep a 4-year-old, trust my own son, sitting at the table at 10 a.m. Specifically for an hour has been really complicated. But then there are moments when I know for sure that he misses his classmates, right? And I know even through virtual learning, it's been really complicated for these students to interact, and they're missing their teachers and they're missing that interaction. So one of the things I wanted to hear is, what are some suggestions you have around how can parents support and help their children, or how can we find ways for our children to positively express ways of their feelings, even as they feel fear and sadness during this pandemic as well.
Right. Thanks, Donovan. And thank you for having me on the panel. You know, I'm a general pediatrician, and trust me, it's been so devastating, you know, what's been going on here in the world, actually. And especially, you know, it's a big difference for our kids. So I think the first thing we have to do is to make sure parents stay calm and parents stay confident, because kids are impressionable and they're watching, they're paying attention of how we're acting. So we have to first stay calm, and we have to make sure we be an example for them. So 3 things I like to tell them is first to reassure the kids, right? So you talk to them, you listen to them, you ask them how they're feeling, and you genuinely listen to their response. You ask them why they're feeling that way, and you try to reassure them that it's okay to be scared. It's okay to worry, and it's okay to be fearful. So you kind of normalize the situation for them. The next thing, you want to have some kind of a routine for the kids, right? So you want to have structure. And so that means that you're going to set a schedule every day for them. So you're going to have a schedule for when they're having their meals. You're going to have a schedule for when they're doing their e-learning with the teachers. And you're going to have a schedule for bedtime, and also some time for them to play and have fun. So after the routine, you want to make sure that you regulate what they're doing as well. So that means that you have to make sure that they're eating well. You have to make sure that they're sleeping well, because if they're not eating well and they're not sleeping well, it's going to just add to the stress and the anxiety that's going on. So you want to make sure that you put fun games in there for them, for teenagers. Make sure you allow them to do FaceTime with their friends, become creative. For the middle schoolers, make sure they do some arts and crafts, and you do things together as a family. So you can watch movies together. I see on Facebook and social media, a lot of parents are doing TikTok videos and dancing. That's really fun. So you try to find things that the kids are doing that's fun. And dads, it's okay to play video games with them sometimes. This is the time for parents to not be hard on the kids. Let's just relax a little bit. Play the video games with them if that's what it would help to get through this time. I think this time is crucial for us to be together as a family and not be so hard on ourselves and not to be too hard on the kids. Some of the things that we have to look out for kids who are getting too extreme stress is if they're complaining of headaches, if they're complaining of belly pain, if they're having diarrhea. Those are signs that you want to look for, especially for teenagers. You know, when kids are very anxious and they have a level of anxiety, they can harm themselves. So you have to look for these signs. And if you see this, then you definitely seek help, you know, but you try to be as supportive as much as possible and look out for signs. But I think the big thing is to make sure the kids feel safe, make sure they feel secure, and make sure that they feel loved.
Okay. And you said the importance of having a routine, and just go back, because I like to personalize this stuff a little bit. My wife, so I'm the one who's always probably breaking the routine a little bit, but she's doing a really good job at making sure. I'm like, 11 o'clock, lunch? What? But at 11 o'clock at school, he normally has lunch.
Right. Right.
Going.
Keep the routine, because then the kids fall in line and they know and they look forward to it. So they know at 3 o'clock they get to play. So they're going to try to do whatever it is they were supposed to do earlier to get to that, you know, and it keeps you sane as well. So it's something for the parents and for the kids.
Got it. Thank you so much. All right. I'm going to go to Arron now. So schedule, and I love that. Schedule, routine, very important, very important. I want to go to Arron now. For the parent of a child or adult living with a serious mental illness, where and how should they seek help? Because not everybody during this moment and during this pandemic could obviously leave their home. So what would you do if you're living with a parent who has mental illness? What are the solutions to that during this pandemic?
Right. So, thank you again for allowing me to be here. I think during this time, you may see a spike and increase in anxiety or in kind of enhancement of symptoms just because of everything that's going on and being um, kind of isolated and closed in our homes. But the same rule applies whether if it was pre-COVID or post in terms of um, getting the person help, whether it be in person, which is not happening now, but it just get them evaluated. Most therapists are doing virtual therapy. That's how I'm doing sessions similar to this forum. So it's really getting the person connected with someone through a variety of mediums, such as New York City Well, and there is Psychology Today also, which is another resource. I'll post that in the chat. And it'll highlight those that are doing virtual therapy sessions. So what's convenient is if your parent or family member would allow you to be present during that intake, you can also be valuable in terms of providing information and historical data. And sometimes we can't get during the individual in face-to-face session. So it'd be helpful that the family member's there and kind of provide historical data if the person doesn't remember certain history or information. And that would be valuable during that intake process. But generally right now it would be through virtual therapy, using Psychology Today or New York City Well, or even through your insurance. Your insurance has a list of therapists that are providing therapy at this time, that are available and providing virtual therapy at this time.
Right. So you're saying virtual therapy, and how would people find virtual, how would they find this specific therapy?
So what I love about Psychology Today is kind of like it's like a one-stop shop where you can put in your insurance information, you can put in your zip code. Like for instance, if someone was looking for me, they could put in my name or they could put in the zip code. So if it's you in the 11412 area or 1434 area, you can find someone in the area, and then you could put in what insurance you have. Would you prefer a man or a woman? It could really kind of drive the type of therapist that you're looking for, and most importantly, that accepts your insurance, so that you wouldn't have a low cost or no cost at all, depending on your insurance, whether you have a copay or not. But that's kind of the best place because you actually get to see the person. Sometimes you get a picture of their office, and that kind of helps to reduce the anxiety. Get to see what they look like, see what the office looks like, and it also reads their specialties. So if you need someone that specializes in anxiety, someone that specializes in depression, someone that specializes in eating disorders, it highlights all of those things, and you could find the person that kind of is the best fit for you.
Awesome. Thank you. Thank you for that. All right, I'm going to go to Nayakia Brown. And, one of the things I wanted to hit on, I got that right? Nayakia.
You hit it right out the park, Councilman.
Doing all right tonight. African Americans are 10% more likely to experience serious psychological distress and are also more likely to experience socioeconomic disparities such as exclusion from health, educational, social, and economic resources. These disparities have contributed to worsen mental health outcomes, especially now during an epidemic like this, the COVID-19 pandemic. What would your professional advice be to anyone experiencing trauma, anxiety, or depression and is trying to cope during this moment?
Yeah, thank you for the question, and as well, thank you for having me as well. I'm honored to be on this panel, one of the panelists on this tonight. So I would say there's one base word that I want to put in the space in answering this question, which is to get into communication. Communication. Say something. Be able to know that we're all going through it, and it's just about being able to speak up. As we often say in our field, it's okay not to be okay. This is not the time to pretend like we're stronger than what we are. We are all processing through this. So as we talked about the different resources that are out there, just to get into communication, find someone. If you're not ready to reach out for professional help right now, be able to talk to someone. Because if we sit with it and simmer with it, those thoughts can turn into other things. And some people may want to begin to have what we call behaviors that are negative. Some people are turning to other things to cope that are not necessarily the healthy way. And so, like I said, it's about getting to communication. Speak your truth, to be able to express it. If you're having challenges, express it. Just to be able to access someone that you feel safe with to begin the conversation. Because we all are going through some form or shape. Even as a licensed mental health counselor, I too am experiencing my own impact from this pandemic. And I too, I'm very transparent about talking and counseling. I too am in supervision and ongoing counseling with my supervisor, right? So I can make sure that I'm doing okay. So this is not the time to pretend that it's anything other than what we're feeling, and to be able to put it in, to articulate it. This way we can begin to help sort it out and get other people to help us sort it out so that we can really see what's going on and not to ignore it. Because if we ignore it, it can turn into something much worse.
Right. And let me go to, I don't know if Milton is on, but if Milton is not on, Dr. Wiltshire could certainly pick up on this. So what should individuals do who for individuals who have health insurance, can or should they contact their primary doctor during this moment for mental health assessment to determine their mental health condition, or what should folks do who don't or do have health insurance?
Okay, so I'll go ahead and answer. So, I think back in the days, it was a little different where, mental health, a lot of people didn't get access to care because, insurances just didn't cover it and it was costing a lot of money. And still today, a lot of people, especially in the Black and brown community, have issues with access to medical care, have access and don't have insurance. But there are community clinics out there in all the communities that see patients without insurance. So they have what's called a sliding fee scale. So if they feel like they need to speak to someone, they just have to go to those clinics, any of those community clinics, and they can pay as little as $15 for a visit. Sometimes, not even anything, because they don't turn away any patients. So when you go to your regular primary care doctor, what they're going to do is first give you screening questions. So you don't have to be 100% sure that you have a depression, because they're going to give you screening questions. And depending on the answers that you give, then you could tell them if you are high risk for depression or you have some kind of anxiety. And then they'll take you to they'll actually walk you over to the mental health specialist. So majority of these community clinics do have mental health specialists, because we know that a lot of the chronic problems we have, a lot of the basis of this is mental health problems. And if we don't fix the mental health problems, then we can't fix the medical problem, right? So if someone has heart disease, we have to fix that person's depression first, because if they're going to continue to drink alcohol or continue to smoke and stuff like that, it's not going to help the chronic medical problem. So we first have to get to the root of the mental health problem. So insurance shouldn't stop anyone. If you don't have any insurance, find a community clinic. The one I'm associated with is Joseph P. Addabbo right there in Far Rockaway. We have 3 of them in Jamaica, Queens. So come, and there are doctors there who are gonna, screen you and give you the appropriate mental health service that you need.
If I could just add something to that, it's one of the primary reasons why the city created Thrive was because of these inequities, because of the lack of access that so many people have. All of the resources that you get through NYC Well, you're entitled to regardless of your immigration status, regardless of your insurance. So there are clinics that have been mentioned, and they're terrific resources. There is Psychology Today, and there's NYC Well. If you want to find out what's near you, if you want to talk about what your issue is, first of all, that phone call or that text or chat is absolutely free. But then you can be referred to people who will see you regardless of insurance.
Thank you. And I think Mr. Milton ABDUL is on, if he wanted to touch on this as well. Is Milton on? All righty, I'm going to move to the next question, and if he hops on, I don't know if he can unmute, but we will try to get to him. I want to go back to Susan. Where and how can people learn about what mental health symptoms and conditions they have, and how can they access treatment and support? And that's for anyone as well, if anybody else wants to hop in on there. But where and how can people learn about what mental health symptoms and conditions they have, and how can they access that treatment and support?
Well, it really builds on the conversation that we've been having up till now. You don't have to fully understand what it is that you're experiencing to reach out for help. If you feel overwhelmed by what you're going through, if you don't understand what you're going through, and you want to talk to somebody to help put it in context and help you understand better how to cope with what you're experiencing, that's when sometimes it's good to go beyond family and friends and talk to somebody who's really trained in how to work with people professionally. I do believe that during this time, it's very important to stay connected with family and friends and your faith community, if that's a essential part of your life. It is also important to realize that sometimes you're not sure why you're feeling what you're feeling, or you need help coping with it. And you want to talk to somebody who has a little more training, a little more distance from your personal life, who can add some perspective and help you learn how to cope. So I'm back to, if you're just not feeling well and you want to talk to somebody, it's a good time to reach out to NYC Well and get connected to somebody, either just for 1 or 2 calls or texts or chats, or you want to see somebody regularly for a while. And almost everybody right now is working with people online through FaceTime or Zoom or Skype. And we're lucky that we're able to do that, that we can help each other during this.
Yep. Dr. Veronica, let's go back to, for anybody experiencing a lot of stress or anxiety about COVID testing, what can they?
Yeah, you can hear me?
And is that natural? Yeah, we hear you. And is that natural to feel anxiety around testing, or feel something just go a little bit?
Right, yeah. So we've been doing testing at the clinic, the Joseph P. Addabbo clinic. Actually, Donovan, what we did, we just literally said, we're going to go ahead and do a 10 testing. So that way people in the community can get the service that they need. In our zip code right there in Far Rockaway, Queens, the 11691 zip code has one of the highest positivity rate for COVID right now. And no one there could get access to testing, right? So we took it upon ourselves to do just that. And you know what we've been seeing, patients are coming in with exactly what we're talking about. Many of them very anxious. Extreme anxiousness because they're scared, they're worried, they just lost a loved one, a spouse 2-3 days ago, and they're not feeling well themselves and they don't have anybody to turn to. Their private doctors are closed and they feel helpless. So they're coming for the test. So a lot of times while they're there waiting on the line, we're doing a lot of counseling, talking to people, just trying to communicate to help ease their stress level, right? The test, we offer it on Tuesdays and Thursdays so that patients in the community can just come. We would like appointment, but you know, even if you don't have appointment, we're still accepting walk-ins because it's important for people to know their status. I feel like once you know whether you have COVID or not, then it changes your behavior. A lot of the people we serve, they don't have big houses for them to separate themselves into another bathroom and to another bedroom. They're all sharing one space, right? So if they know, then they'll really take it a little more seriously to make sure that they don't mix with the older person that's in the house, that's over 65, that's at highest risk, right? So it really makes a difference in those people. And also they're essential workers. They have to go to the to deliver the mail. They're the ones doing the sanitation. They're the ones driving the MTA buses and trains. If they know they have the disease, they're not going to continue to go to work. They're going to stay home until and isolate until they're well. So it just eases a lot of anxiety, and it's going to be better for everyone overall. We all know that with a lot of anxiety, it increases these hormones in our body that can affect our coronary arteries and worsen heart disease. Heart disease is already a #1 killer for Blacks, right? So we don't need extra stress at this time. So if the testing and them knowing their status so they can take care of their families or go to work if they don't need to stay home so they can provide for their family makes a difference, that's what we have to do. So people don't have to feel anxious. If you feel like you're having symptoms, coughing, difficulty breathing, you're feeling weak and you want to test, come to the clinic and we'll test you. And it's simple like that. If you feel like you were exposed and you're not sure, come to the clinic, we'll test you. Once you know your status, I'm quite sure that it will make a difference.
That's a great answer. And yeah, and just go back through that one more time. So it's natural once again to feel that anxiety. One of the things I started to feel, and I don't know if it was just me, like even going on a trip to the supermarket now, like, you know, is it natural to feel a little anxiety doing that now?
Yes, it is. It is because, you know, you're not sure where you're going to catch the disease from because you've heard don't touch surfaces, right? But my thing is, don't panic. Just be prepared. So when you go outside, you know you have to do social distancing. You know you're going to wear your mask. If you have some hand sanitizer, soon as you leave the store, you use the hand sanitizer. If you don't have hand sanitizer, that's fine. Soon as you get home, you wash your hands. So those are the kinds of things. Once you keep it in your mind, you should feel empowered that, okay, I have some control. So, you know, with this disease. So try to keep your distancing, wear your mask, wash your hands. If you do those 3 things, you're going to be good. Of course, you know, you can, a lot of times craziness is happening with this disease, but if you try your best to wash your hands, no matter what, even more so than wearing the gloves, wash your hands. As soon as you leave that store, or as soon as you finish pumping the gas, or as soon as you get to your door, that alone can help to decrease your anxiety by doing the correct things, following the guidelines.
Thank you, Doctor. Arron, I want to go back to you, and I don't know if anybody else has anything to add on that. But Arron, I want to go back to you. So many think of depression as the blues or something to snap out of or to pray away. Research has shown that Black communities rely on faith, family, and social communities for emotional support rather than turning to healthcare professionals, even though medical or therapeutic treatment may be necessary. How much you suggest an individual seek professional advice to avoid underestimating COVID-19 mental health symptoms and impacts?
Wow, so that's a lot there.
A loaded question. So
Yeah.
it's a misinterpretation, right? I mean,
yeah.
those social gatherings. I mean, it's a loaded question, and anybody could hop back in. But how do we seek professional advice and not underestimate the symptoms and impacts here?
Well, one thing, as the leading, you know, paragraph you stated that, you know, us as persons of color, we do lean heavily on our faith, right? So that is kind of deterrent from going to seek mental health. You know, we pray about it, we fast about it, we lay at the altar, we lay prostrate. All of those things is what we do, but I think the conversations about mental health are increasing so greatly, and even churches are talking about it, that we understand that you can still pray and you can still go to church. I did another Zoom with a lot of ministers and pastors, and we're talking about how the kind of the lasting change that this is going to take when we return back. And return back to church, and what that's going to look like, and what pastors and ministers have been through in terms of, because they have been affected by this as well. So in terms of getting help, I feel like everybody, if they feel like they need help at this point, you have no choice but to seek professional help. Everybody, pastors, bishops, everyone has been affected by this. Parishioners, just the loss has been so great that people are going to need support. At this point, we can't look at what somebody's going to think, because it's been affecting everyone. And the conversation on mental health has been normalized greatly. There are some people who still don't feel that it's necessary or needed, but I would honestly say that the first thing is to recognize that you have an issue, and one, and then two is identify resources where you can, such as I said, going to New York City Well, Psychology Today, and they're confidential. And that's the first part. A lot of people think that, somebody's going to find out, anything like that. It's very confidential. We uphold that we maintain your confidentiality.
Thank you, Arron. I want to go back to Ms. Brown, Nyakia.
Yeah.
What guidance can you provide for people living together in close quarters, such as people who share a small apartment, or for people who live in the same household with larger extended families? And I just want to touch on this very briefly before you answer this question, because one of the things we've been calling for the mayor to do, and I think we made some slight progress on, is to open up hotel rooms. I think he might have agreed to 10,000, I think, so that, those who live in close quarters can self-isolate during this time. But even when you self-isolate, I'm sure staying in a hotel room won't resolve all your issues. You may still need assistance. That separation will impact the family. So can you speak to what would be some strategies that we use if we're living in close quarters?
Yes, I agree. I'm grateful that those resources are being considered and made possible, because people do need a place to quarantine if they're living in close proximity to their loved ones. So that being one thing. But if we're in the same space and we may seem like we're more on top of each other than usual because there's no going out as we used to do, you want to be able to create a schedule that's been talked about, even for the adults. I have a client who is now, she used to work nights and her loved ones work during the day. And now that's not the case because everyone's at home, right? And so now the whole idea of when do we take showers, having a schedule, because now everyone wants to use the bathroom. We only have one bathroom, there's 6 of us in here. So being able to work together and be in communication about how we're going to do things orderly, right? When does this happen? How does that happen? The other thing I want to put into the space is allow exercise to take heed, whether it be a fresh air, just get some fresh air, getting outside to move your body, because that's another thing we want to be mindful of. It's not the time for us to just be sitting around and not allowing our body to move, because that can lead to other illnesses, right? That we want to be mindful of. Another option that I've also been sharing with clients is to get yourself some earphones, get a headset to be able to, go into your own little zone, whether it be doing your own meditation, whether it be listening to an audio book, whether it be listening to music, be able to steal away, if you will. And if everyone is kind of doing that in their own space within the house or home, it allows for us to reduce the anxiety that we may be experiencing in such a time like this, okay? And also be able to use our words and be able to let each other know how we're doing, what we need, Also being able to create healthy boundaries, Everyone's not going to be feeling like doing the same thing all the time, but be able to communicate that. Another thing I've been sharing with clients is the phrase of, when emotions are high, logic is low. And this is a season where there's a lot of emotions in the air. We're experiencing a range of emotions. And so we have to be really mindful not to act out in our emotions. So if we can take a step back at times when we're experiencing things or we feel that we're getting charged in emotions, just to take a step back. And that would be a good opportunity just to take a step outside and kind of take a little break and walk, right? Of course, having your protective gear, so that we don't get in contact with things that we may not want to and then bring it back to the home, right? So those are just a few things. But the main thing is just to be able to be mindful of each other and what we need and what the other person may be needing at any particular time in the house.
Mm-hmm. And also, Donovan, just to piggyback on what Ms. Brown was saying, because, when the space is so small, I know a lot of times people get anxious, especially if someone is sick, because we've been having a lot of patients call us, say, my grandma is sick, so what should I do now? So some of the simple things that they can do is just to make sure you create some kind of separation in the room. Even if it's one bedroom, hang a shower curtain or a sheet or something to kind of separate the sick person from the rest of the household. Make sure if you can move the beds a little further away from each other, so that way you have a 6 feet gap. That helps. Even if you can sleep like head to toe, so that way if two people are sleeping together, they can, not the faces aren't at the same level, sleep the opposite way. So those things help. And again, with the bathrooms, make sure whoever is sick, once they're done using it, they clean it, disinfect it, and make sure they're wiping down the surfaces frequently, because a lot of us don't have the privilege to, be fully separate from each other. We have to kind of like to work around the person who is sick in the house, right? So some of the things we can do is just try to create that 6 feet gap in separation. A simple sheet. Also, run the fan, open the windows so fresh air can circulate in the room or in the house. So simple things like that. And definitely whoever is sick in the house have to wear a mask at all times.
That was great. Let me ask this, and I'm going to dibble and have questions from the public as well. Is anxiety, and this is from Gloria, is anxiety a mental condition? Anybody answer that?
This is Nike. Anxiety is very normal, right? That's the whole. It actually helps us when fight or flight. It's when anxiety is prolonged and it becomes excessive that it becomes a not so helpful thing. And so I don't want people to think if you're feeling a level of anxiety that something's wrong. No, definitely given where we are right now. If you're not experiencing anxiety, I would say that something was wrong, right? But anxiety is very normal in any given situation, but definitely right now, we just want to be mindful of the excessiveness of it and it causing us to do things that's taking us in a negative direction. We want to be able to assess that and be able to interrupt that to get some support so it doesn't take us and spiral us out of control.
Right. And sometimes, Donovan, sorry, it gets too bad to the point where it starts to physically affect you. So then it's bad, where you're having severe belly pains, diarrhea, you're trembling. You can't perform normal functions because you're physically sick. Then that's not good.
Yes. So just to add, we naturally have anxiety. If you're going to perform in Madison Square Garden in front of millions of people, you're going to have some anxiety about that. But when it's...
Do you mean Michael Jordan had anxiety too?
Of course, yeah, absolutely. A lot of performance anxiety. A lot of artists, a lot of singers, you actually have some anxiety before a big performance or before a test or before a conference at work, anything like that. But when it interferes with your everyday functioning, going to work, going to school, like the physical symptoms, then that's when it becomes a more of an issue. I'm very transparent with my clients about my own, as a therapist, I do have anxiety myself. My wife is a therapist as well, so she helps me. Yeah, so I'm able to, manage my symptoms through prayer, meditation. A lot of people usually like tidbits. So there's apps called Calm and Headspace, which is offering free service to New York City residents. So I use that daily just to manage my symptoms, so that because it could feel like medical symptoms when you are not aware of them, and it feels like heart palpitations and things like headaches, and manifest in different forms. So anxiety is real. Anxiety is and something that we all face, but when it becomes and takes over our lives, that's when it affects us on a different level.
I think just say there are lots of resources out there for people who feel they just want to read some tips or materials that say, here's some things you can do. Here's how to cope with the stress that probably most New Yorkers and most Americans and most people all over the world are feeling right now. So there are good materials on our website. If you go to the health department's website, there's a document specifically about how to cope with stress. There, as you mentioned, there are resources about how to do breathing exercises, how to meditate, There are apps out there that help you. I think the really important thing that all of us are saying is it's absolutely natural right now to be worried, to be nervous about our future, to be frustrated, to be sad, to be even grieving the loss of not just family and friends, but even our city, to be grieving community and all of our attachments to people. But when any of those feelings become so overwhelming that you're not functioning the way you'd like to be functioning, that's when you should be seeking help.
Hi, and this is Anna. I just also wanted to piggyback off what Susan said, that yes, to learn more about stress and coping and grief, on the Department of Health website, there is a tab for coping and emotional well-being. And as well as there's also the New York State COVID-19 emotional support hotline that's available from 8 a.m. to 10 p.m. 7 days a week. And that number is 844-863-9314. So if you want extra resources that are available to speak to someone as well.
Thank you. And let's stay with you, Anna, for a second. I want to talk about, so let's speak about domestic violence for a second and the impact on mental health during COVID-19 and how someone can get help, especially if they live at home with their abuser. And, you know, as a chairman of the Public Safety Committee at the council, we've seen this troubling trend sort of calls decreasing around DV, which is not necessarily good because we know more people are cooped up. We know that there's a lot more domestic violence happening than what is on the mere surface of what we're seeing. So can anybody touch on what should we look for? How can people get assistance during this time when people are cooped up and their abuser is in the household with them?
I can talk about that. I think I'd like to divide it into what someone who is experiencing that kind of abuse can do, and then what people who may be aware of people who might be experiencing abuse can do. So first, people who are experiencing it, this is a time to realize that our shelters are open. The city's domestic violence hotline, which is 1-800-621-HOPE, is running 24/7. You can still call and get help, and people can counsel you about what your options are. So help is still available. You may decide that you want to stay in the situation. What can you do to make yourself safer? How can you develop some kind of a safety plan? What can you do? They can counsel you. Our family justice centers, and there's one in every borough, they're also operating remotely, and they can talk to you during the day, during the week, and again, the city's hotline can talk to you 24 hours a day. But we also know, and I think you were alluding to this, that in close quarters, when you may be around the person who's abusing you more than you were otherwise, may be difficult to reach out. It may be harder for you to do that. So one thing that we're asking people to do, which we do all the time, but even more so now, when you're in touch with family and friends and even neighbors, sometimes it's helpful to have signals or code words that you can use, so that if you're on the phone with somebody and you suddenly say, whatever that word is, you suddenly keep saying green, or you have a light in the window that you flicker at a certain time, or you're banging on the floor or the ceiling of your apartment, you're telling that person that you have a signal that says, I'm in danger right now. I need you to call 911. So this is a time to bring in other people into your safety plan and to say, I need some help. It's as high a priority for the city as it ever was. Domestic violence officers are reaching out affirmatively to people who they already know might be vulnerable, and we have pushed out more messages. The calls to the city's hotline have started to actually increase every time we put out one of those mass email blasts or text blasts. But we're all worried about this. We're all concerned about it. I think it's time for people to realize that help is still available and that you can help other people who you think may need your help. Reach out to them and ask them whether this is a time that they need your support. One more point I'd like to make is that a lot of people who are in danger worry about going to shelters right now. Are they open and are they safe? Can I remain healthy if I go? What many people don't realize about domestic violence shelters in New York in particular is that they come in all kinds of sizes and shapes. Some of them are involve communal living, but some of them have separate apartments, and some of them are apartments within larger group structures. So if you call the hotline, they can not only counsel you about what you might be able to do, whether you need to pack a bag, whether you need to have a safety plan, and counsel you about how you're feeling and whether you want to stay or whether you want to leave, what resources are available to you. They can also tell you about shelter options right there on the phone. And you can make the decision yourself.
Right.
This is a time for the public to not say, I hear what's happening in that apartment, but I'm not going to do anything. Or I know that my niece or my mom or my cousin or my friend is in danger, but it's none of my business. This is a time to reach out by phone and say, is there anything I can do to help you?
Right. And this is a matter of life and death in a lot of cases, right?
Yes. Yes.
Someone doesn't pick up the phone and call, that, I mean, someone could lose their life. So I really want to urge the public, if they hear something, as the old saying goes, if you see something, say something. If you hear something, say something, because the worst thing that can happen, specifically in our community, especially when it comes to DV, you know, it's a silent killer. You know, people are behind closed doors, but if you hear something, you need to certainly say something. Don't hesitate to reach out. Call your precinct, call 911, but please take this seriously, specifically now, because we know there are a lot of people behind closed doors who are suffering during this moment.
May I add to that as well?
Yes.
I also want to just put it into the space, which is also be mindful of our children, right? Many of our children are home, and some of them are in homes or environments that may also find them to be the subject of abuse. So if we can just be mindful of that, you know, when we see something that may not be, you know, sitting with us, it's, you know, not to be afraid to just, if it's about just reaching out, so that if need be, those in power authority can just do a wellness check, just to check on things. But some of our children are subject to being home with some environments that can be abusive to them. And so we just want to make sure that they're on our minds as well.
Let's get in.
Could I add something also, Donovan? It's Milton.
Yes, please.
I just wanted to add something, just piggybacking on Susan's
Hey,
comment.
Abdul. Finally.
Hey,
Hey, good to see you.
I finally got a chance to get on. I wanted to just piggyback on what Susan mentioned regarding that help is still available, especially on the health insurance side. Of course, even with domestic violence and other issues that individuals are currently facing, one of the issues that they may very well be facing is how in the world I'm going to actually pay for health insurance. So again, New York State of Health has made it possible for assisters, individuals who actually do help individuals to apply for Medicaid, that they're allowing that to be done not face-to-face anymore. They can actually do this over the phone. So New York State of Health has made it possible for telephonic enrollment of individuals. So individuals who have lost their Medicaid coverage, again, they can now speak with an assister, all right, and they can assist them to actually get their Medicaid back working. And again, this would actually relieve a tremendous amount of stress from individuals who may very well be finding it very difficult at this time, finding out, well, how in the world I'm going to get my medicine? Who am I going to be seeing the doctor if they do not have health insurance? So again, that's available. New York State of Health has made that possible. So now individuals can now call in, actually get that assistance. And through MetroPlus, we can actually do that because again, we do have staff members Currently we're working remotely. So our staff members are available. They can call our 800 number, and I'll actually put that on the chat feature as to how they can call us in. And we'd be more than happy to actually assist anyone to actually apply for health insurance, again, through the New York State of Health.
Thank you, Brother Abdul. Let's get into frontline workers quick. For people who are working on the front lines away from their families, what resources are available to them, and what do they do? What do these resources do? Because I've heard a lot of stories of nurses and doctors and people who are really facing trauma. Are we doing enough to make sure, one, they know that resources are there, but can anyone speak to what is available to them? How are they coping? What could we do to help them cope?
So there's general resources for everybody who's on the front lines. Either if they're city workers, there's the Employee Assistance Program. There's always NYC Well. The health department has resources for people who are in healthcare, sort of personalized things that you can do. There's a data sheet on their website. But Health and Hospitals is also, and the city in general, is mounting a very large initiative to make sure that there's a hotline for healthcare workers, that they are helping each other. There's a peer-to-peer support. There's a way for people to check in with each other. I think there's really an enormous amount of work that's being done. But I think what you're hearing from the mayor also is that we have about 25% of city workers are what we would call essential workers, people who are still working, still commuting to work. That's a lot of people. And we know that their trauma, their personal trauma, the grief that they experience, the depression that they're going to experience if they're not already, we know that it's going to be magnified by their work experience. And so we are going to need to mount a massive mental health initiative for the entire city, and particularly separate for healthcare and essential workers.
Mm-hmm.
If you call the New York State hotline right now, not the NYC Well number that I'm saying, I'm actually talking about the state helpline, you will also see that they have particular resources for healthcare workers. But there's support out there, and there will be more coming.
And even in the, per communities, because I know at our clinic, we've started what's called a virtual Stay Well mental health service. So we have our staff, we're giving them the opportunity to speak with one of our mental health staff for free without, any issues, just to support them, and also to have group sessions. Because I think during this time, especially for the doctors and nurses, it is so hard mentally for them because there's death all around. I mean, every day I'm hearing stories, I'm a pediatrician, so it's not bad for us in peds, but for the adult medicine doctors and the nurses who are working with the adults, every day is some patient that, that was quite fine 2 days ago, and the next day they're dead. So it's so hard for them. And a lot of doctors and nurses are very stressed. They're very depressed. And so we have to do something now to prevent this mass trauma from happening later on. So even the outpouring that we're seeing for frontline staff, I'm so grateful for that, because I know that it means a lot just to get a free meal at McDonald's, even though, I'm quite sure they can afford it, but just the thought that they're being supportive, the thought that people are saying thank you, the thought that people are allowing healthcare workers to go to BJ's to get their groceries, those little things count, and it does make a big difference. So if we can do more of that, that also helps too, to just kind of look out for the workers, because what they do on a daily basis in the hospital, in that clinic, it's a lot. It's a lot.
I think we're talking about supporting.
Anna will touch on this too, being that she works for Department of Health.
Oh, absolutely. All of the resources that we have available for our general public are also available for our frontline workers. Reaching out to NYC Well, reaching out to the State Department of Health, going on our website to see what kind of, resources might be available and tips. We're absolutely thankful and grateful for our frontline workers for all of the things that they do. And we're encouraging people who are, you know, mildly and moderately sick to try to stay home. Everyone should stay home as much as possible. Also in support of our frontline workers to try to social distance and make sure that we're not infecting people on our way to and from things that are not essential and necessary. And, you know, going in to the hospital to emergency room when it's actually like an emergency, and utilizing conferencing with your doctors and online portals to communicate for any kind of you know, symptoms that you may be experiencing. And in that way, also honoring our frontline workers and making sure that all of the equipment, resources, and testing is done for those who are in highest need for it.
Susan, you wanted to add something?
Yes, I was going to say that I think there's sort of three things. There are three ways that we need to be supporting our essential workers. And I'm broadening it beyond healthcare workers, but their needs are absolutely critical. There's the counseling and support, both the peer support and external support that we're offering. There's the community support that I don't think we can overestimate how important it is to have the 7 o'clock applause and the sirens and the bells and everybody saying, we believe in you and we support you, and the meals that people are providing. But then there's also mounting an effort to get more and more testing and protective gear and gowns and PPE that all of these workers need. And that's a very concrete way of saying, we believe in you, we support you, and we're doing all we can to keep you safe. So we want to protect your mental health. We want to show you how much we care about you, respect you, and believe in you. And we want to do something very concrete, which is try and keep you as safe as possible as you do your job. And that is just coming online more and more and more every day with people, you know, as you know, from individuals sewing masks at home to massive efforts and shields being made by factories that were never doing that before, and gowns that were just this enormous contribution of surgical gowns that was just announced today. That's a very real way that we support essential workers.
Thank you for that. I wanted to hop in. I'm going to hop back in. There was a question from Alicia. I think she's out of the Rockaways on the close, well, actually the cut of the summer youth program. And remind people that we're just starting budget negotiations with the mayor, so it's not necessarily a done deal. And he certainly acknowledged on a call with the council last week that, you know, we need to work towards a medium on this. But let's speak about teenagers for a second. I mean, what do they do in the event? What creative things should we be thinking about or telling them to do during a period when their parks are closed, when the beach is going to possibly be closed because of COVID, and they're told to stay in their homes all day? What are some things we should be thinking about for teens?
Mm-hmm. I think at this time it's important for us to talk to them. Constant communication, because we don't want them to disappear and in their corner and, you know, and get depressed, right? Because it's so hard, especially for those who are graduating high school and so on. No, they're not going to have their proms and so on. So we want to be as supportive as much as possible. I think at this time as parents, we have to come down to their level and do things with them. You know, I mentioned before, even if you have to learn the new dance that they're doing, like try to be that cool parent. It's okay during this time. I think this time is a crisis. So all other things that's out the window, we really have to be very supportive and try to spend as much time with them as possible and make sure they also get time to spend with their friends, whether it's FaceTime or so on and so forth. But also to make sure we talk with them and see where their mind is at, and you know, encourage them that everything is going to be okay. It's a difficult time now, but you know, I think everything is going to be okay. We have to keep reminding them that we're going to be fine.
Anybody else have anything to add for teens?
Yeah,
I would go ahead.
No, go ahead, Susan. I got you. I'll come back.
I know I was a crazy teenager, so I can imagine being locked down in the house. But yeah, but go ahead.
I mean, I think it's important, and I would defer to our pediatrician on the panel, but I think it's important to recognize that your teenage years are kind of a time when you are distancing yourself from your parents and their authority, and being with your peers is really paramount. It's what you want more than almost anything else. So I think one of the things that parents can do is help their teenage kids find creative ways to be with their peers, whether it's talking to them about hosting a virtual dance party or playing games online or doing something really old fashioned like actually talking on the telephone. There are ways to connect to your peers even now, but not to try and pretend that that doesn't matter, because it does matter to them. And the other thing I would say is, I think that something that we don't often talk about is it's one thing to sort of talk about coronavirus and what it's about and explain that to our teenagers. But another thing that you can actually do is watch something together, watch the news together, watch a show about something and talk to your teenagers about their reactions to it. Engage them in the same conversation that's going on in your head. See if you can ask them to join you and talk to each other about current events. And then also just maybe watch a movie together and talk about something else, but engage them.
Nice. Let me go to a question from Annette Cohen. A lot of people wear gloves when they go out. Can that cause the virus to spread more? I know that's a little off topic, but I guess DOH is on the line. They may want to answer.
Yeah, so I just want to speak to this. Just in general, gloves and surgical masks are part of the PPE that is absolutely crucial and necessary for our frontline workers. Those are in the hospitals and nursing homes and our emergency responders. So, limiting the use of that is our guidance. And so for anyone going outside, wearing a face covering, which is just any kind of cloth or paper covering that covers your nose and mouth to protect others in case you are asymptomatic but still may be spreading the disease. And in terms of gloves, just washing your hands will do the same thing as using the glove, because the virus itself is a respiratory virus. So it's important that we're not touching our face after we're touching different surfaces, so that whatever we might have touched on a surface, we're not bringing into our respiratory system. And if we are coming into contact with things with our hands, just to make sure that we're washing our hands with soap and water for 20 seconds, singing that happy birthday song twice, and or using hand sanitizer if we don't have access to soap and water at the time before we're coming into contact with our face or other faces. And just kind of also to speak to the point that was said earlier about people living together, but outside of just disinfecting the bathroom, just disinfecting in general frequently touched surfaces, and just wearing that face covering inside the home as well. But just doorknobs, car handles, steering wheels, any kind of groceries that we're bringing in, just disinfecting them. And after we do all of that, still washing our hands before we do that. So basically the use of the gloves is not absolutely necessary, as long as we're just practicing really good hand hygiene.
Right. Question from Mitchell Harris.
I think for your listeners, it might be helpful to know it's certainly not absolutely necessary, but the city's providing 400,000 masks and gloves to all NYCHA residents. So that's on its way.
And that's a big deal. And also testing for NYCHA residents has done as well.
Testing,
and
food delivery, calls to see how people are doing.
Right, door to door too.
Door to door.
Some of the groups we're working with as well, the rapid responders, I believe, started in the Rockaways, but they're going to be making their way to Jamaica now and all across the borough. Really take advantage. That's my staff.
We're going to reach everybody.
Well, Mitchell Harris had a question about virtual trainings, and are they available around mental health and special trauma-informed care training? Are those things available? And where could people find them? So training specifically around virtual trainings around mental health and trauma-informed care trainings.
So I'm gonna get back to where we started the evening and encourage people to get on the Thrive website and look at the guide for what you can access while we're staying home, and follow us at Mental Health NYC. Follow us on Twitter at Mental Health NYC, and you will see announcements of webinars, announcements of training, announcements of particular events that you might want to just listen to. But there's a lot of training online these days, more to come. There's plenty to access.
And just go through seniors as well. How can seniors get help if they don't have or know how to access computers? That's from Teresa Scott. What could seniors do? What is available?
Again, there's a whole section on our website about seniors and the kind of mental health support that they can get, and we're adding to it on a daily basis. Right now, the Department for the Aging has started making phone calls to seniors that they're aware of and they're in contact with. NYCHA is doing the same, and we're about to launch a much larger effort to reach seniors in a number of different ways to make sure that they're okay, that they have safety, food, and they have the mental health support that they need. So anybody who feels that they right now need help with that can contact the Department for the Aging, and they will work with you. But there are also very specific ways. If seniors are homebound and need food, they can call 311 and they can get food delivered to them at their door if they can't leave. If they're not getting their medication, we'll find ways to help you get your medication as well.
And that food is free of charge, my friends, and my staff.
Absolutely free of charge.
Advantage of it. And I'll be doing some deliveries as well. Somebody had a question on kosher meals. Yes. I believe just started. And
they have kosher meals as well. But yeah. I would just suggest that you can call 311 for food. You can call the Aging Connect hotline. I'm looking at the number 212-244-6469, or just Google Aging Connect. But you can reach out. There's plenty of support for seniors, people who were either vulnerable before this crisis or have now become vulnerable because suddenly they're homebound where they weren't before.
And we're going to start the wrap up soon, but I want to get through a few more questions. I want to thank everybody for their patience tonight. We made it work despite the obstacles, but that's what we do. I want to go back to Arron and Nayakia on when meeting with a mental health professional for the first time, what kind of questions should one ask?
Okay,
so for the first time meeting with you, what should I be looking for? How do I know you're legit? I mean, what are some things we should know? You know, I mean, I know we get, you know, we had, what was a lady called me, I'm a psychic.
Right. Right. And she wasn't a psychic. Right. Well,
Miss Cleo.
People look for. What's her name? And I'm slipping up.
Miss Cleo. I think.
Miss Cleo. No, you're not Miss Cleo.
Right. So, like on Psychology Today, for example, that has our license number, that has our education, where we accredited, you know, that we accredited institution that we went to. All that information is on there. But generally during the first session, I always invite my clients to ask me questions in terms of my specialty, my skills, how long I've been practicing. Sometimes I like to ask me my age, but I don't disclose that unless need be. But people, you know, they're going to be sharing information, so they want to feel comfortable too. So I definitely allow for conversation to be had, because you definitely want to feel comfortable. So, you know, just having an open dialogue of questions, any questions you have, you know, your therapist should be open to asking related to how they will best help you. So just write down. I always encourage you to write down a list of questions. Generally during the screening over the phone, they're very, inquisitive and asking questions about the therapy process. I explain to them what it would look like when they come in, what should they expect, how long it's going to take for the first session, the certain information I'm going to need from you. You're going to fill out a thorough intake packet. And the first session is generally about asking questions. We talk about the confidentiality agreement, which people are really, really, important. They want to hear about that, what that looks like, and what the trajectory of therapy, what it would look like. They really want to know, am I going to get fixed today? Generally, people want to come in the first day and want to get fixed, as they call it. And definitely I explain to them what therapy looks like, that it's definitely a journey. Sometimes there's, solution-based therapy where it's kind of short-term, very, condensed. They may have one issue they want to work on, but generally speaking, it may be ongoing. So I kind of explain to them there's going to be a journey, and this is what therapy looks like, and your availability. Do you want to come in once a week, twice a week, everything like that? But generally, come with a list of questions that you want to ask. If you, like I said previously, if you have any specific issues like you want to work on, then you may want to find someone that specializes in. If you have an eating disorder, then you want to find a therapist that definitely highlights that they specialize in eating disorders, because they can best serve you.
Thank you. Ikea?
I would just add, Arron did a great job. I would just add that, there's no question that can't be asked on the first visit. It's really about building a sense of trust. For a lot of times, it will be a person's first time or interaction with a health professional or mental health professional. So we are very used to just being able to share what we know, and also to reduce any anxiety they may have about getting this type of support and help. So there's no question too small or too big. There's no question stupid, all that. Just come being willing to ask the question and be able to receive information.
And Dr. Wiltshire, if you just wanted to touch on for children, what should we do? Will children require therapy after this, or what should?
Yeah, I think so. And I think that's the main issue that we have to worry about, the trauma that's going to be left after this, right? So we need parents to pay close attention to the behaviors of the children. So if you have a 6-year-old who was fully potty trained, then all of a sudden she's wetting herself every second, then that's not normal. So we know there's something going on there. There's some kind of psychological problem. So it's things like that that we have to pay close attention to. Someone who's being extremely emotional, or all of a sudden being extremely aggressive, out of character. Those are things that's different. You look for signs that are different, and that's when you know that, okay, I have to go and seek professional help. And like the other people on the panel were just mentioning, it's important to research someone who you'll be comfortable with. A lot of resources are out there. It's okay to take time and get to the right person, because you want to feel comfortable with that person. You want somebody who's going to show empathy, somebody that you can relate to. I know for me, a lot of my patients, when they come, they research me long before, and they're happy, when they come, and they know what they're looking for. So it makes a difference who the therapist is, and it's okay to research someone who looks like you, if that's what you want, someone who sounds like you, and that will make you feel better. That's fine. Whatever it is that will make you want to keep coming for your appointment.
Yes.
And
Sorry, one more thing, the councilman I want to add is that I see children for therapy. And in addition to that, I'm also a New York City school social worker. So I'm working with parents on just navigating this remote learning and what that looks like. So as I transitioned my children that I saw, in the brick and mortar to virtual, I told the parents that it's very important that we continue our therapeutic relationship, because that adjustment is going to be great in terms of seeing their friends every day, and now having to meet with them on Google Meet or Google Classroom, anything like that. So it's quite a challenge in terms of helping the children adjust to learning from a iPad, or seeing that their teacher, like this way instead of, in person. So a lot of kids are having adjustment issues in terms of and adjustment to working from home. Like you have to redirect them. You know, they kind of like during session, run into the kitchen and like, I'll be right back. Like things that they wouldn't do at home, going to grab something to eat and just kind of.
Got a camera in my house? Okay.
Yeah, right. So having to kind of reinforce that.
His mom during this afternoon session. It's me in the morning that's having the real
right.
struggle.
It's challenging for parents. I mean, I have a 3-year-old and my wife is doing Class Dojo, and we have to get him online to do Class Dojo for a 3-year-old. So it's a lot in terms of the kids adjusting as well to not seeing their friends, not seeing their teacher, and sitting in front of an electronic device. A lot of children have terms of attention challenges and like that, how to redirect them. That's the biggest issue parents are asking, how to help them adjust. And that's where someone said schedule. Really post it on the wall, a literal schedule that can mirror the school schedule. And I always say, encourage more breaks. So this is where parents have the opportunity to implement more breaks in that school cannot afford. So 5 to 10 minute breaks can be a little bit more frequent as opposed to at school where it's a little bit more structured and regimented, because they're gonna need breaks. They're gonna need more.
Susan.
Yeah. Go ahead.
I just wanted to add that if you're not already connected and working with a therapist, that all of the mental health services that the Department of Education offers during the year, they're offering now remotely. So the school response clinicians, the clinics that they have in schools, the mental health clinics, they're all seeing students. So a student can reach out via their teacher or their guidance counselor, but a parent can also reach out by talking to either the school guidance counselor, the resource center, or again, if you get on our website, we have a section for students, how to access all of the community-based organizations that the Department of Education partners with to provide mental health services for students. They're all doing it still remotely. So you can get on, you can look at the list of community-based organizations and say, oh, I know that one. I'm near that one. I'm going to call them directly. Or you can call the school and talk to the guidance counselor. There's also a parent resource center where parents can talk to parents about kind of the question that we were asking earlier. I think my child might need therapy. What do I ask? How do I approach this? What kinds of questions are important for me? And you can talk parent to parent about that circumstance. Sometimes that's really helpful.
We didn't touch on kids who may have challenges communicating. I mean, what do we do there? If you have a child who perhaps is younger than a teen who may have struggles with communication and their feelings or disabilities, or a disability for that matter.
So similarly, kind of get them to draw it out, and have them express it through drawing, using play therapy. I enjoy doing that with kids, allowing them to express themselves. Kids have emotion. It's just a matter of how they express it. It may not be the most effective at that moment in time, but they definitely show emotions, whether it be sad or happy or upset or things like that. So definitely allowing that open dialogue to ask them how they're feeling and adjusting. Like I said, my 3-year-old verbalized that he missed his friends at school. So just allowing for that dialogue, and kids sense when parents are anxious and things like that too. So even being open to say, mommy, daddy's also very sad about missing, not going to work and stuff like that. Would you mind if we talk about it? Would you like to draw it? Things like that. Just having that open dialogue.
That's great advice. All right, we're going to begin to wrap up. So one of the things I wanted y'all to touch on, just as we begin to wrap up, and I want to thank you all for your patience tonight, and thank everybody who's watching, because I think this is one of those topics we like to all skate around, specifically in our communities. It's very important that we start to have these open dialogues, and have these dialogues even more often, even after COVID leaves. By God's grace, we'll stomp this thing out eventually, and we will. But the trauma and the things that have long impacted our communities won't necessarily disappear just because COVID disappears. So we still have a lot of work to do. What routines would you suggest for people? And I guess this is for all the panelists, including ABDUL, people do who are struggling with disruption. And I think you just mentioned, we're used to going to work. We're used to going to the park or the playground with our kids. We used to even going to get a haircut, take my son to get a haircut, right? I mean, just those small things. People are used to taking their daughters to get their nails done, and we're missing those emotional bonding around a lot of this stuff as well during this moment. So what could people do during this time to cope with that once again? And what advice would you give to people, once again, who are suffering from anxiety out there? What could we do to strengthen our mental health during this period, each and every one of us, myself included, during this period of a lot of trauma?
I guess I'll go first, and then I'll be done talking.
No, you're good. You're good. I was just gonna simply say that you know, all that's a part of our grief and loss. You know, it may not be in the magnitude of death, you know, and we're experiencing that as a collective as well, but we're grieving our routines. You know, men are grieving the fact that they haven't been able to go to the barbershop like they've been wanting to go to. You know, and that is really a part of their weekly or not bi-weekly routine. And there's a lot of that going on. So I really want to be able to say, we want to be able to join one another in that grieving process, to be able to say, this is really happening. And to know that we have to look at this as a space of, we have to accept it for now, right? This is just for now. And here's the other part. This may be a great opportunity for us to show up our skills and things that we may have given ownership to other people. You know, like if you were used to getting your manicure, pedicure every 2 weeks, you know, someplace else, this may be a great time for you to sharpen up your skills. The same thing with shaving. This may be a great opportunity. So we want to be able to lean into things that we can do, right? And it's a lot, and be able to be creative. You know, we are very much creative beings. And so some of those things that we may have gone outside the home to do, there's a lot of things that we can begin to, like I said, lean in and be able to do at home for ourselves, or even allow one of our loved ones to do it for us, and we can trade off, right? So we want to be able to know that we can, and we will. And this is a great opportunity to do so.
Well, I'm proud of myself. I haven't cut here in a while, since my teenage years, and I did, for those who missed that post, I did my son's haircut this week. He certainly was grieving his barber on Sunday at 4 years old. He was a little upset. He was like, "Daddy, you're not a barber." But I didn't do too bad tonight either, right? Like today, I went and shaved. I did okay. All right, it's my second time just doing it all myself. So you're totally right. And guess what? Even during this period, we could learn to save a little bit of money now. Now all the things that we used to just go and flush money down the toilet on, we're learning to budget, because you can't be out there every day either now. So there are some things we can learn during this period as well. But you're certainly right. If my wife is watching, I look forward to doing your hair. All righty, I'll go to Susan now.
Well, I think you're asking the right question, which is sort of how do we cope? And besides all the things that we've talked about, which are sort of having a routine and engaging people, and I would add two things. Besides, of course, bottom line, if you're not coping, seek some help. That's just add that to your routine that you're doing that. But I would say I would add two things, and one is that I think it's really important to add to your routine connection with other people. That's something that you're not going to forget about, that you're going to remember to reach out to family and friends and make it part of what you do on a regular basis, because you need to feed that part of you that lost some community, right? You need to just remember to do it. But the second thing I would say is that I think we're all craving community, and we're accessing it in different ways. But something that really helps your state of mind is if you feel like you're contributing something positive to others, whoever that is, whether it's your neighbor who needs some support, your family member who needs some support, your neighborhood or your city, but engaging in some positive social activity is good for your mental health, makes you feel good. And I would say to think about adding that to what we're doing while we're staying home. Think about doing something for others, even behind closed doors.
Thank you. Did you go? I'm sorry, I'm getting Nyakia, did you go? Did you close out? Okay, you did. Okay, so we're gonna go to now Dr. Wiltshire.
Well, for me, I think just to, as a mother, because, you know, I'm a working mom and it's been very, very hard having to work full time and then come home and try to make sure the kids did their e-learning and so on and help with that. So for me, I think I'm coping by just realizing that, telling myself that it's okay to not be perfect at everything. It's okay. You know, I'm not going to be the best cook and I'm not going to be the best teacher, but that's okay. So for parents out there who are juggling, you know, work and having to be a parent at the same time, it's okay to know that during this time to try to spend quality time with your family, try to, you know, create lasting memories, memorable and meaningful memories. And I think that's my take home from this whole thing. Memories with your family and quality time, and try, and it's okay to not be perfect, and it's okay to have a break.
Abdul. Unmute. Oh, there you go.
Yeah, don't be afraid to actually ask for help. In this time, individuals tend not to feel that they need help and they don't know where to actually get this help, but just definitely do not be afraid to ask for help. Help is available. And if they seek that help, then of course, the rest assured individuals will actually kind of help them out to, I mean, this panel certainly provided so much information this evening, again, to the entire community on the mental health issue. But again, just asking for help and just be open when that help is given, that they accept it. And that's indeed critical if they're going to actually move forward on this.
Anna.
Yes, thank you. You know, I just wanted to say that it is common to be experiencing grief, given loss of routine, loss of interaction, for some of us, loss of our jobs, financial distress, and loss of loved ones as well. There's so many families that are impacted by this, and we know someone who has either lost a family member, or we have lost family members and friends. And, you know, through this really trying time, it is important to try our best to stay positive and remind ourselves of our strengths at this time, and, you know, go outside to get some exercise while practicing social distancing and, you know, covering our faces and mouths with face coverings, but at the same time, just taking a moment to go outside, take some deep breaths. And the coping strategies that were mentioned just now, they help us build resilience, right? And one of the things that create anxiety is just not knowing what's going on, and all of the things that are floating through social media, through the news, and also knowing how to filter that out and knowing to turn to good resources and find out good information from reliable resources and not giving in to everything that's happening. And, you know, limiting screen time with and social media exposure if possible. And then take a moment to go and again, visit like the new Department of Health website. We're updating it every single day with new information, new data, new guidelines as more things are becoming available to our knowledge as to what this virus is. This is a new virus and things are changing rapidly as we're learning more. And so this is a time to just monitor our health more closely than we have ever before, and just, you know, take a moment to be in tune with our bodies. And just take some deep breaths. Mindfulness was mentioned before. There's so, you know, the apps that were mentioned here, like Calm and Headspace. I do that in the mornings for like 5 minutes and just take some deep breaths and getting ready for the day ahead and the things that, you know, I expect of myself, but also just not expecting too much at this time, that it's okay not to go ahead and become the most wonderful baker that there is at this point, you know, because everyone else seems to be doing it. And just take some time to rest as well as possible. If you have the opportunity, you know, we are told to stay home, and as anxious as we are about all of it, to just take that opportunity to rest and be still and take, you know, some time to ourselves if we can. But again, just wanted to close out saying that there is the Department of Health website at nyc.gov/health/coronavirus. And you could also text the word COVID, COVID, to 692-692 for real-time updates that get texted to your cell phone. And on our Twitter and our social media accounts, there's also videos and webinars that you can watch. And again, every day we're updating you with more information. Thank you so much.
Thank you so much. And last question, anybody could take this. We're about to all try to get to bed eventually. And sleep anxiety is real. And I know I got a question from Jamila on that. So if anybody just wants to chime in, what are some things we can do to sort of reduce anxiety right before we go to bed?
Turn off if you're watching the news, I would suggest turn off the news. Somebody asked a question about being scared, and definitely social media cleansing is very, very important before bed. Bath and Body has some calming soaps and things like that. So it's literally one called Calm or one called Sleep, and it has like lavender and chamomile in that. And that is a great way to kind of just before you go to bed, kind of take that bath or a shower if you have the luxury to. And again, one of the apps have, if you could sleep with waterfalls, kind of like, it's like a guided imagery. So have waterfalls or rainfalls or the woods, if you like, you know, hearing crickets, and kind of changing the atmosphere and kind of closing your eyes and kind of calming down those anxious thoughts before you go to sleep. And I think even if you, the question that you asked before, Councilman, was how do you manage? First, acknowledge your feelings. If you can acknowledge that I'm feeling scared, I'm feeling upset. I mean, that's what I had to do, even as a clinician, when this all started, because there's an adjustment and that fear of the unknown. If you could put a name to it and kind of acknowledge that and honor it, and that it's okay that I'm scared, I'm concerned, I don't know what's happening, and then that could kind of give us, okay, so what's the next step that I'm going to do? But if we have, a lot of people are unable to put their feelings into words, so it's just a ball of confusion. You're feeling a ball of emotion. But if you could say, you know what, I am feeling scared, I am feeling anxious, and then you can kind of explore what the next step is going to be. But with the sleep is definitely trying to limit the phone before bed, turn off the TV if need be, kind of distract outside forces and kind of create your own little cocoon in terms of like positive imagery. Or if you need to hear a song, Pandora, put it on a classic jazz station or something like that, and just play some calming music before you go to sleep.
And if I can add, breathe. Just to be able to take in some good quality breaths. You know, I'm finding that people have not breathing or getting a full range of breath. And that's also contributing to some of our anxieties. Just to be able to do, you know, before you go to bed, if you can take some deep breathing, do some deep breathing exercise, just to kind of just quiet the body. And this way you can get a hopefully a peaceful night.
Well, I want to thank each and every one of you for coming on tonight. I want to thank all of the community members who joined this necessary conversation as we all battle some forms of anxiety and depression, and certainly our normal routines being interrupted. You know, it's very important that we take the advice of many of the experts who were on here today. So it's okay to have anxiety is what I heard today. It's just, what do you do with it? How do you address it? All right, so it's normal. I found that out tonight. Like I said, going into the supermarket, I was starting to feel, I was like coming out feeling a little weird, and I'm like, am I suffering from anxiety? but I heard that that's natural tonight. It's nothing wrong with that. Meditation, finding those apps. Everybody's online tonight watching this. Download an app that which can help you calm, communicate, finding a normal routine to talk to your loved ones or to your community, because we're missing that. And then admitting when you need help and getting that help, seeking help. There are resources out there. They're all on each and every one of these pages. Take advantage of that. And it's okay to grieve. We're all grieving, but it's how we grieve, it's how we cope at the end of the day that will get us through this, before we return back to some form of normalcy, and then in a year later be at parties probably. But the bottom line is now, this gives us a moment to pause to really look at all of the issues, whether personally or for our communities, and seek ways to address those things holistically. But it all starts with yourself as well. So I want to thank all of the panelists. I want to thank Susan. I want to thank Anna for being on. I want to thank Nayakia, Dr. Veronica Jackson-Wiltshire, and Arron, and Abdul, of course, from Metro Health. Thank you all for being on tonight and pouring into the community. And I'm sure we're going to make a difference. Somebody on this line tonight heard something they needed. Somebody needed assistance somewhere. If we save one life tonight, we've accomplished all that we've needed to do tonight. So thank you all. God bless you all. This will stream on YouTube, I'm sure on Facebook and whatever else the staff figures out on this stuff. But please share this video. It's very important. Even for those who may not have joined out of fear of seeing their names attached to it, it's okay. Take advantage of it, download it, watch it in your own space. And God bless you all. May everybody have a great night, and may God be with each and every one of us. Thank you.
Thank you.
Thank you so much. Have a good night.
Bye-bye. Thank you.
Thank you.
Good night, everyone.
Thank you. Thank you.
Thank
Good
you.
night. Thank you.